so this skill is measures urine output, and we're going to be emptying Miss Felicia's catheter into a graduate, measuring it in cc's, and then recording the output. So from the beginning, wash hands, knock knock. Hi Miss Felicia, Brenda, I'm going to be your CNA. I'm going to empty your catheter, okay? She said okay. All right, so after I've washed my hands, I'm going to go ahead and put on my gloves. And I'll go over to the designated dirty area and get my urine graduate. You can use a graduate, a bedpan, a urinal, anything that you have to empty a catheter into. You're going to need 2 paper towels. One is a barrier, and then one's going to be used to wipe the catheter tubing afterwards. Okay. So one barrier goes down on the floor, and your graduate sits on that. You always want to make sure that your catheter is only attached to the bed frame and never to the side rails. You want to keep the catheter bag lower than the level of the patient's bladder. Most catheters are not going to have this box on the front. This box is for ICU patients. So if you just imagine this box isn't here, the other catheters are just going to have the bag. So we're going to pull this out of the cover, hold it over the graduate, and you don't want the end of the tube here to touch your graduate at all because you don't want to contaminate the system. We're going to unclip it. It's easiest to use your thumb and push the clip away to empty the urine. And you might kind of notice the patient's, the color of the urine as well. That's important. And we'll go ahead and kind of make sure you get all the drops out. And this is the part where you're going to need this other paper towel to clean the spout. Make sure it's clamped. In nursing homes, they still have carpet. And if you don't clamp it all the way, when that bag fills up, it's going to get the carpet all wet. And if you notice I'm squatting, that's the reason you never put your knees down on the carpet. Okay? Put it back in its holder. And remember to attach it back to the bed frame, not on the side rails. We're going to go ahead and carry our urine over to the designated dirty area. You want to put the urine on a firm surface and measure it at eye level. Measure it in the increments that it's measured in. So this particular graduate is measured in 25s. And so we have 450 cc's or milliliters. Cc's and milliliters is exactly the same thing. So 450. We're going to go ahead and dump this into the toilet. So you could have used one of these as well, anything that has measurements on it. Since your hands are dirty, pull a paper towel to turn on your water because we want to rinse it. Anything that ever had urine in it never gets dumped in the sink, only into the toilet. Once you've rinsed it, dry it out. Store your container into the designated dirty area. Gloves off, and every time you take off your gloves, you say wash hands. Wash my hands. And let me go check on my patient, make sure she has her call light. All right, Miss Felicia, thank you for letting me empty your catheter. Here's your call light. Do you need anything? No, are you comfortable? Yeah, all right. You call me if you need anything, and I'll be back in a little while. Make sure the bed's low and locked. Wash your hands. And then, remember, if you didn't chart it, you didn't do it. So, we have a piece of paper here that you're gonna have to document the urine output. You need to put the time that it was urine, write urine, the amount, it was 450 cc's, and then your initials, and then sign. And this is the piece of paper you're gonna have it state if this is your skill.